So if you are thinking of bariatric surgery, usually you need a dietitian to sign off for insurance purposes. I do take insurance. I take most major insurances, so most people see me with no out-of-pocket costs, which is really, really great. And then I also offer self-pay as well for patients that don't want to use insurance or I would be out of network with. A pre-op patient I usually see at least twice. Sometimes insurance requires us to meet more than twice, but we'll kind of go through what to expect from a nutrition standpoint after surgery. We'll set some goals to work on before surgery to prepare you. I always say we perform surgery on the stomach and not the brain, so we really need to work on making these lifestyle changes before surgery so they don't feel so overwhelming. And then after surgery, I'm also with you to create a meal plan. Your food is constantly changing after surgery. You'll notice your portions will be changing, the texture of foods will be changing, so I'm there as a support person through every step of the way post-op as well. So I meet with you pretty consistently, especially that first year after surgery. But then it's also important to have that lifelong support afterwards as well. I also offer bariatric support group meetings. Those are free last Wednesday of every month on Zoom, so they're virtual. So just having that support, bariatric surgery is a big lifestyle change. So making sure that you feel supported not only with your personal life, but also with your medical care team too, and I want to be able to provide that. I work with your doctors as well. I share an office with a surgeon. I've worked with multiple surgeons in the St. Louis area, so developing a close relationship, if we're all on board, then that's really going to set you up for success. An initial consult for bariatric surgery is pretty informational too, so I'll go through, usually in that first consult, we'll go through everything to expect nutrition-wise for bariatric surgery. I think it's nice to know, what you're getting into. This is a really big decision. It's a lifelong choice, lifestyle change, and it's good to kind of know all that up front. But again, we'll set some goals to work towards as you get closer to surgery. But that initial consult is pretty informational to really make sure that you feel prepared. I have everything printed out. You get the handout to take home, and then follow-ups are more diving deeper into lifestyle changes and the why behind why we're eating the things that we're eating and how we're feeling about the things that we're eating.